Hi, Carrie.
Good morning. How are you?
I'm great. How are you?
Good. It's nice to be working from home and see the sunshine outside.
It is nice to be from home. I threw
Oh,
my back out yesterday putting my socks on. That was awfully active of me.
that does take talent.
It does. That's pretty much par for the course for me.
Love it.
So I'm sitting in my chair today going every time I move.
That sucks. That's
Yes.
just not fun at all.
The kids just know to ignore me or ignore my screaming unless I call their name. It's pretty much how it is here.
Well, that's a good way to, make it so everyone knows the game plan.
They do. They do. Yes.
I'm so excited. Tomorrow we're going to go, well, actually, it's on Saturday. We're going to go see our TED Talk in Oshkosh, Wisconsin.
Yes. I'm thrilled too. That's going to be fun.
I've never been there before. I'm kind of excited to go see what they're going to do.
Yeah, I am too. I remember reading the speaker list and it sounded pretty cool. There's going to be some AI in healthcare.
Really?
Yeah,
AI is kind of a cool thing. Like, you would think that as a teacher that I would hate AI because students have the ability to go on and like create papers through AI, but I have found that it's actually very helpful as a teacher to write test questions. So I put in exactly what I want as a question, and then it helps me come up with the other three or four answers. Like, I know what the right answer should be, but sometimes coming up with all those other answers, the wrong ones, can be kind of a challenge. And AI has helped me decrease the time of writing my test a little bit, and that's helpful.
yeah.
What
I also write. I write fairly well, but AI certainly writes better. And I have found that as we work on, I think people are aware, maybe they're not actually, that you and I have a business together online, and we help network marketers build business without sounding spammy and weird and running off their family and friends.
Yep.
And that's pretty much the gist of it. And we have to manage a whole bunch of Facebook pages. Right now I'm managing 5, and you're helping manage 3 of them.
Yep.
And trying to generate enough content on there can be very difficult. And so what I have found recently, and I'm guessing that you've noticed that the difference in my writing style recently has been there has been a difference in my writing style recently because I've been having AI help me generate content that is helpful for the network marketers we're supporting on there, because I have asked them to do things like generate tips on, and I've given it content that I wanted to generate tips on, and then I've gone back and edited it to support what I'm looking for our marketers or for the people looking for our products. And it's been great because it provides a great framework in seconds what would take me an hour to write down myself. And so it's saving us so much time, but still providing really high quality work. So I can see that in any field, but especially in healthcare, like you said, I can tell the difference between correct content and not correct content. But to have it all generated for me is fantastic.
Right. But you have to use it as a tool like anything else. You use it as the basis, and then you make sure that it's correct and what you want. That's one thing that I argue with my students. I'm a nursing instructor, for those who don't know. And one thing that I argue with my students is math equations. And they're like, why are you so emphasizing all this math stuff when the computer's going to tell us what the math should be? And I keep trying to tell them it's because I want you to know what the right way to do something is. If you see that you are giving a child 30 milligrams of something, you should be able to identify, oh my God, that's way too much. I'm going to kill this child. Or, yeah, that seems about right because A, B, and C, right? And so for them to identify, good versus not so good, I need them to have that mental ability to be able to do that. And not all of them seem to grasp that yet, but they'll get there.
Yeah. I mean, I know this was not supposed to be our topic today, but it's an interesting thing to talk about. That's why we're unscripted. So that's very interesting because I know it's very, very different now. And you may not be aware of this, but when I started, I worked at a very poor hospital, and it was very interesting because we did not even have smart pumps. So a smart pump is an IV pump that automatically calculates the rate that an IV drip should go at. So if you're on some sort of medication that needs to be adjusted sometimes every few minutes to keep your blood pressure where it should be or your heart rate where it should be, nurses are in there all the damn time adjusting those rates up and down. Then we have to write down on a piece of paper what we've done. Well, now these pumps are smart and they know exactly the concentration of the medication and the weight of the patient and how much you should do. Well, when I started, they didn't have that. So we had pieces of paper taped to the IV pole, and you had to know because we even mixed our own medications. If the pharmacy didn't get them in time, we mixed our own medications up. So you had to just have an idea how much was too much, how much was too little, and how much you should go up by because you didn't the pump wasn't going to tell you, you just needed to know. And nurses these days think that they're always going to have something to back them up. They're always going to have it. And then you think about times like, let's go back to uh, Katrina, the hurricane, or even more recent storms that have put power outages for days and days and days, and you don't have any electricity and you're working without electricity. Well, you have to learn to titrate medications by drops, and you can still do that. Do you remember doing that?
Oh my God, yeah.
Do
Those
you
drip
still teach
rates.
it?
I'm sorry.
Do you still teach it?
Um, I don't, but other people do, yes.
Yes, so
Because
it's
in
still something you're
pediatrics,
supposed to learn.
oh yeah, they should
Yeah.
learn it.
Yeah,
But
so there's
certainly they
still
don't
the
know.
ability to measure how fast an IV is going by how many drops go through an IV chamber, a drip chamber. And that's how they always did measure them before there were even IV pumps.
Oh yeah,
And
you had to count the drops.
yes, you had to count the drops.
Yep.
And you can still do that if you don't have an IV pump. You can still run it that fast. But
You can figure something out without a machine telling you how to do it.
yeah, I know, right? And you'd think, I think that maybe nurses think that would never ever happen until you're in one of those situations where you're like, oh, damn it, what do I do now?
Yep.
You know?
Yeah, I know I haven't worked in the field in a little while, not too long. But boy, when you go to those downtime forums where like the computers are just not working right now, it's like some of the ER just wanted to shut down because they just didn't know what to do. It's like, oh shit, excuse my French, what am I supposed to do now? It's not telling me what to do. And you need to be able to know what to do. And that's what I'm trying to get across to my students. And, they're still very smart individuals. I'm not insulting any single one of them. But yeah, I mean, they have to understand that those oh crap moments are going to come and you're going to have to know what to do to fix it.
Yeah.
And that's a big thing. So
Yeah. We had a hospital right up here in the Appleton Fox Valley area in Wisconsin that got uh, what is the word? They got hacked and all of their computer system got frozen and they couldn't get in at all. Do you know what I'm talking about?
yeah.
And so for months, they were
No.
completely on paper. They couldn't see any of their patient records. They couldn't see anything they had to do. So there is a way that they can go back into the backups and get enough information about a patient, but they had to chart on paper and do everything on paper for months. And while you're recovering all that information, it's scary as hell trying to
Oh yeah.
treat patients, especially who are critically ill, when suddenly you don't have the support of all of your computers and your machines and your everything and have everything at the I mean, even so, even giving medications off of a MAR, which is a medication administration record on paper, when you've always used a handheld computer
Mm-hmm.
that tells you what to give and then you scan the med and then it tells you if you're right or wrong, you become very reliant on that to tell you if you're making a mistake.
Yeah.
And
I
the,
remember though when I first started in the ER, man, I was in charge a lot when I first started in the ER. I don't know how or why, but for whatever reason, my manager liked me being in charge, and I was in charge probably 4 out of every 5 shifts I worked, which meant that I triaged every freaking patient, which, is fine. That was part of the job, but it was a lot. And back then, we couldn't just verify meds by going through a list that was already there. You had to write down every single medication every time. And like you said, people didn't know what meds they were on. They'd be like, the little blue pill for the heart blood
Yeah,
pressure.
the yellow pill that makes me pee.
Right.
And I think I take, I don't know, the middle dose. They went up from the small dose.
Yes. So we're trying to treat people in an emergency situation and then, of course, hand them off to you in the ICU saying, yep, they're on a blood pressure medication. They think they took too much of it, but they don't know the name of it.
Yep.
Mm-hmm.
Yeah.
And we do have old records, but boy, we'd have to find somebody, especially on the off shift, to go downstairs in this room full of records and records and records to bring them up to us. And then we'd have to page through them in our free time to figure out the latest medical record that says what medications they're on, which may or may not be updated if they go to more than one hospital.
Or how about, so I was the EMT that went through their bathroom that took all of the medications that I found and threw them in a garbage bag and brought them to you and said, I don't know what they take, but I found all of this.
Oh, I can top that. I had an EMT who had to bring in the medications, and guess how they brought them to me? More than just in a bag, they brought them to me in an ashtray. Like, yes, the patient dumped a bunch of each kind of medication into an ashtray, which obviously wasn't being used as an ashtray. But there was just like this plethora of pretty little pills in there. And we didn't know how many of each one she was taking or what any of them were for. So thankfully, we had really great pharmacists where we could like pick one of each out.
Yep.
Put them in a plastic bag, send them to a pharmacy and say, please help me identify these, because of course we were too busy to do it.
But this was prior to Google, when you could just say, Google, hey, Google, what is white pill 166 imprinted on it?
Yeah. It's funny how things have changed though since we started.
Hey, Google, cancel. That's 50 milligrams of metoprolol, by the way. That must be in my head somehow.
That's funny.
Yeah. Not the first time I've had to do that.
So, boy, I lost my train of thought because
You sent them down to the pharmacy in a baggie, and he brought them to you in an ashtray.
Yeah, but I was going somewhere. Totally lost it. I had a point. It was funny.
Yeah. Don't remember. Well, no matter what, that's a mess. I can remember that. All of that was just, it is much nicer now when everything is electronic and it transfers from hospital to hospital, because when electronic records first started, we're really dating ourselves here. When you first started, was it all on paper?
Oh, absolutely it was.
Yeah, so we were paper charting too. Nothing was electronic. I remember when we went to electronic records, that was you would think, oh yay, electronic. No, that was no fun.
No. Well, it was a huge change. And honestly, in some ways it's a change for the good, but in some ways I feel like it's not a change for the good, because I feel like I was way more detail oriented when I had to write it down.
Oh yeah.
I described things more. I was more detailed about patient came to the room. She was wearing this. She complained of this. This is what she looked like. And now you're like, click, 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 patient alert, patient oriented, ... And it's just like these key words, but it's not like as specific as what we used to be.
So I can tell you a very personal story here that is about patient charting. So I needed to grab the records from my daughter's hospitalization stay this last February. And she was encephalopathic, which means she had inflammation in her brain, the lining of her brain. And she was out of her mind, like completely nuts, because you're not with it then. You're not competent. You're not okay. She's been sick for a long time with an autoimmune disease that attacks her brain. So her behavior was very off. She was ragey. She was swearing. She was not lucid or knowing where she was or what she was doing. She was very naked. She was having horrible OCD, rinsing her hands, rinsing her feet. Um, and no one wanted to take care of her, obviously, because they were treating her like a psych patient because she was so difficult. She was trying to refuse her treatment because she didn't understand why she needed it. She thought and she also has autism, so she's not fun to deal with. Um, and the whole hospitalization up until the very end, because she was getting these infusions of intravenous immunoglobulin, which were antibodies that were helping with the illness. Um, it was drama the whole time, like huge, horrible yelling, screaming drama, and so much going on, and ripping out IVs, and so I looked at her charting the whole time, and it just said things like patient alert oriented, no distress, and blah,
Wow.
blah, blah. You would not have any guess from looking at the nursing notes that she was a complete nutcase the whole time.
That's
Like,
so
like you can't
dangerous.
even tell what she was in there for. And there was a point where we went through trying to declare her incompetent so that I could force her to have treatment. And we decided not to. It was so late in the hospitalization. And that's what you're saying, is that the nursing, there's no actual nursing note now, where we used to do a long nursing note every shift, that
Yeah.
I would have written something like patient in acute distress, ripping out IV, appears agitated, and I'd have gone on and on and on about what the situation looked like.
Which doesn't help. Like you said, if you do need to go and get custody or, ability to help take care of your family member, or let's say it goes to court for some other
Well,
reason.
yes, I need to go get guardianship. And so I was looking at the notes to see what I could take with me. And there's nothing in there that implies that there was anything wrong
Yeah.
in that. Because my problem was I couldn't get her to agree to treatment. And so my point was going to be she needs help agreeing
Right.
to treatment. And you'd
There's no
think you'd think,
documentation.
oh, she just came
No,
in because, I don't know, she wanted to be there.
that's scary. It's hard because one thing that I'm trained in is forensic nursing. I'm a sexual assault nurse examiner by um, trade, I guess. I don't know. So I did that for many years in the ER, and we learn very detailed way to document, like, to the T, so that this stuff can go to court.
Hmm.
Because if we don't, then the perpetrator can get let go, right?
Yeah.
We need to very specifically document. And I try to like reiterate this. So I used to go into the mental health class, the class that teaches mental health nursing. And I would tell them, all right, I want you to think about the last sexual encounter you had with somebody that was mutually, that you wanted to be in, right? You wanted to be in this sexual encounter. Okay, now I want you to turn to your partner, and you and your partner are going to ask each other questions. So tell me who initiated what, who kissed who first, where did you get kissed? Was it on your neck? Was it on this? Did they lick you? Did they touch you? Was it under your shirt or over your shirt? And I like went very detailed, and all of them, their facial expression was like, you've got to be kidding me. We are not doing this. And I, of course, did it for the effect. And it was pretty entertaining to watch them because I did this several semesters in a row, and they all kind of gave the same freaked out look. But that's how specific we need to be when we're doing SANE charting. But they don't realize that this is really how detailed you should be as a nurse, so that we can go back and look at it and know. Now, obviously, we're not talking about sexual assaults in most
Right.
cases, but we should be able to look at something and say, yep, this patient had a bruise on their left leg when they came in. It wasn't created because I did something to them.
But
But
there
they're not.
is nowhere to chart that anymore.
No, but they could if they wanted to under just the note. They could
Yeah.
create a note to say those things, but they're not trained to do that anymore.
Yeah.
And I don't know that that's such a good thing because I feel like they're missing out.
Yeah.
But there
Yeah.
is good things about technology that we didn't have way back when. I remember, this was what I was going to talk about earlier, was I remember being in the ER, and of course we all have a sarcastic sense of humor because that's who we are. And a lady calls up, and this was probably, the 10 millionth call that we've gotten similar to this, where they're calling you up and they're like, hey, nurse, I have this rash, and it kind of looks a little pustule, but it's not really draining. It's kind of all over, but it's kind of not. And you finish the conversation and you hang up and you look at your colleagues and you're like, yeah, I totally wanted to tell them to take the phone, point it towards their rash so I could see it over the phone. And you're joking about it, like, give me an effing break. I can't see through the phone. And now technology is so amazing that now we could actually see
Right.
very clearly what this rash would look like and maybe even be able to help them over the phone. But I remember back then just thinking it's the most ridiculous thing ever that we'd ever be able to communicate or see each other
Right.
face to face. And that wasn't that many years ago. I'm not 90 years old, but I feel like it some days, but certainly not. But yeah, I mean, it's crazy how technology has changed in some ways for the good. It's so great, especially during COVID, that people were able to have audio, video conversations with like a therapist, and they could, do therapy from their own home. In fact, I'll admit that I was one of those people that over the last however many years, I've had times where I wanted a therapist and somebody to talk to. And I've been blessed to be able to have a great therapist that I could talk to online, and we could just talk to each other. I could see her, she could see me, and we could have a conversation without me actually having to go in and be there in person. But yeah, some of this charting it scares me because,
Yeah.
like you said, you go back to it and you can't recognize it.
No, you wouldn't be able to look at it, and it wouldn't spark any kind of recognition of who you looked at, and or and sometimes you in the ICU, you remember how well. I'm sure in the ER the same thing. How incredibly detailed the charting was, at least for us.
And it needs.
It was like you had the 5 fields of lung sounds, and then you had all the heart sounds, the detailed heart sounds, and then we did assess all the skin everywhere, and then all the pulses everywhere. But then I came across a day where everyone had been charting the pulses on a leg that wasn't there because he'd had an amputation, and it had been days that people had been copying and pasting and changing the assessment, and they hadn't noticed that he had had a below the knee amputation on one side. And so in that case, it's not so good. You just need to
No.
make sure you're paying attention. But
And it puts all of us in a bad position too, because those of us who are charting and doing a good job,
yeah,
it puts into question all of us. Like, well, what are you nurses doing if none of you recognize that this patient doesn't have a leg and you're charting on it? So what does that tell me about the rest of your charting, right?
right, right.
It's scary. It's very
Yeah,
scary.
yeah. But the biggest advantage nowadays is that the huge majority, and I don't know what percentage, but a lot of facilities all have integrated health records, so you can pull them from one place to another. So when you go, to some little clinic here or there, or you go to the hospital here in town, everyone's records pull over. So unlike when you have to carry the bag of meds in from the EMT in an ashtray, they can just look up and say, "Hey, it looks like you had been taking this in the past. Are you still taking that?"
Yeah,
And we get a much better idea of what someone's health is, which is, it's good for us and it's great for them.
absolutely. I know we live in a smaller community, and I know that we can actually get records from either hospital at each hospital. So we can't necessarily change anything from the other hospital's record, of course, but we can see them. At
Yep.
least providers can. So, if you were at the urologist at the opposite hospital, the urologist at hospital number one can look back at their record and see what they saw,
Right.
see what tests have already been done. Because yeah, it's nice to have a second opinion at a different facility, but then that physician can actually look at both hospitals' documentation and be like, oh yeah, their records do show that they went and did these 6 tests. Now I don't need to repeat 3 of them.
And
But
then
before we would have repeated every single test, which is amazing. So
and I'm guessing that you're, maybe not quite as extreme as my situation, but when you have as many complex medical conditions, because with my Ehlers-Danlos, my connective tissue disorder, there are a lot of illnesses that fall under that umbrella. So the older I've gotten, the more diagnoses I have picked up. So the more specialists I have picked up. So my medical record is hundreds of pages long. And when they ask me, yes, when they ask me, When's the last time you had an echocardiogram? When's the last time you had an EKG? When's the last time you had an MRI on this leg or that leg or your brain? I'm like, I know I had one. I have no idea when.
And the
So at
older
least
we
I
get,
can say
the less our
probably.
memory works, you know?
Yep, yep. So they can dig back in the labs and look it up. They can dig in the chart and look it up. And then in the past you would have had to say, I don't know, let me go get my medical record and dig through the 400 pages that I happen to have on hand, which you don't really have on hand. Um, so you're much less likely to have them repeat a test when they can just look at the results and compare them. And it's very handy. They don't have to go down now. Oh, X-rays, that's awesome. X-rays and MRIs, they're all digital now, so they can just drop of a hat, grab them up, and look at them.
Do you know how many times we would delay transfer of care, either to another facility or even to the ICU, until we had documentation of the radiology report? So we would have to wait till we got on disc a copy of the MRI or the X-ray or the CT showing whatever ailment it is, maybe a bleed in the head or whatever it was.
Yep.
But we couldn't let them transfer without that disc. So we would have to wait for somebody to come in from home to download on a disc what this MRI looked like so we could
Yep.
send it along on transport. And then once you had the disc in hand, then you could contact the transport team, which then said, oh, we're 45 minutes out. And you're like, yes, but my patient has a bleed in their head. Hurry up and get here.
Yep. And by then the bleed is bigger, or the lung collapsed all the way, or then you got to take another scan and it's outdated already.
Change, yeah.
Yeah. Or they died.
Well, let's hope that's not the case, but it could be. Could be. Unfortunately, nurses can be a little crass about these things because
yeah, I'm not laughing because they died.
If you take it all so personally, you just take it home with you, and then it's hard. I mean, even with your daughter, you were kind of joking about, how crazy she was and how nobody would want to take care of her. And that's the nursing side of you where we know we're kind of joking about it, but it is hard. I mean, it's hard as a nurse and it's hard as a parent to have.
Oh, it was horrible. It wasn't, there was the part that was just a little bit funny when you go in the room and she's like stomping up and down naked in a bucket of water because her feet are but it's not funny. The whole thing was not. It was a horrible experience. But from a nursing perspective, when you're telling the doctor, don't go in the room, and he's, don't go in the room, I'm trying to tell you, and the nurse is trying to tell him ahead of time what's going on in there, and he walks in the room and he opens the door and then he closes it again, and the nurse literally goes, I told you.
Yeah.
It's like that. And so I laugh about that because I'm like, well, you could have listened, dumbass. Oh,
yep. Yes. We've had a few of those moments, those little I told you so moments where the doctor doesn't want to listen to you until it's too late. Do you have any good memories of those? Any good stories of when you tried to warn a doctor and they didn't want to listen?
I have bad stories of when that happened.
Yeah,
but
hear one.
Okay, so I had, we were a teaching hospital, so we had residents, and I had a patient that was dying. And I actually kind of told you this story a little bit from a humorous side, but it was not humorous to me at the time. But when we do withdrawal of care, we were really good because we had orders for how to do withdrawal of care. And you ahead of time would get morphine on hand and a patch to help with, you make a lot of secretions in your mouth when you're doing that, and medications to keep people comfortable when you're going to take the tube out. And I had been asking the doctors to get me all that on hand because it's too late by the time you need it. You have to have everything ready. And they were saying, no, let's wait till the family gets here. And I was saying, no, we really need to do this now. And the family was coming, and I knew what was going to happen. And there was two of them there. And that was the woman whose brain herniated, and she sat up in the bed and vomited everywhere. And at that point, I went out, and there's only twice I ever raged at a doctor. And I raged at the neurosurgeon who was teaching. I raged at all three of them. but I just said, you made the family's last experience of their mother the worst experience they could ever have. All we could have done is had her death be, make the death on our terms and make it be something that was okay to remember. And that's the worst thing that they're ever going to remember. And all we had to do was be ready for it. And I kept telling you to be ready for it. And if there's anything you can teach your residents, it's not to ever do this again. But I might have had my voice raised a lot louder than that and been a little bit more rude. And they kept apologizing. And I kept telling them, don't apologize to me, go apologize to the family. Cause it's, I'll get over this, but they won't.
Yeah, it's hard because sometimes those doctors don't want to listen to you because they think they know better, or they think that they don't have to listen to the nurses. But we're at the bedside so many times, so much hours, so many minutes of the day that it's unfortunate when they don't listen, and then we have to be like, see.
They were too new to not know what they didn't know yet.
Yeah.
And so then they knew, you know, then they knew.
Yeah.
And they felt really bad, but you talked about getting therapy. That was I had a really, really, really bad week that week, and I had three things that stacked on top of each other. But that actually led to a really. This would be a conversation for another day. But I had a terrible PTSD episode, and that one stacked on top of two other ones, and I ended up off work for a while. And I don't know if you ever experienced that, but that was unpleasant.
The worst one I ever had, and I won't go into detail because it is kind of triggering for me, if not others, is a 13-year-old that died. And it was a very horrible tragedy. Was struck by a car on the freeway. Her and her friends were running across the road trying to meet up with some friends in the dark at night. And it was a freeway. Like, they weren't running across a kind of busy road. It was a freeway. And unfortunately, the last one didn't make it. And that was a pretty rough situation. So that's probably the worst one I've ever had, but definitely one that sticks with me, and I'll never fully get over it
Yeah,
because it was so traumatic. And honestly, she never ended up truly being my patient, but I dealt with
everybody's
the
there.
situation for hours.
That was mine too, and I won't get into depth either because I just still don't do well with it. But I think that was the problem too. Is we had one that was a motorcycle accident, and he should have gone to the trauma unit, but the trauma unit was full, and he was bleeding, but we didn't know where, and we couldn't turn him because he was so unstable, and it was kind of like coding a patient for 6 hours. And I'm not saying we actually coded him, but I don't know how many liters of blood product we put in, but we replaced his whole blood volume at least once. But we were trying to keep him alive for his mom to come and and preserve his organs because he already wasn't, you know, brain dead. But it was the trauma of it felt like it never ended, you know and I think that's what it was for me. But and it was worse than that. But yeah, and so like you said, there's still very triggering things for that. Even that was in 2012,
Yeah.
and it still goes on.
You know, it's amazing. I don't function in the ER or ICU anymore, but it's amazing the little things that can be triggering to you even years later, like seeing people on a motorcycle without a helmet. I hate driving behind those people, A, for fear that I'm going to be the one to hurt them because they swerve and they fall
Yeah,
or whatever, but also just knowing how many accidents I've seen. We used to call them donor cycles
yeah,
because honestly, we were the neurointensive care unit. We saw the worst of the worst, the people that were on motorcycles that didn't have helmets on. And don't come at me in the comments telling me that people don't always get hurt on motorcycles and they're fun and whatever. I've enjoyed motorcycle rides myself, not gonna lie. Did I go without a helmet? Absolutely, I have in the past. But there are times, especially on the freeway or on busy roads, where you see somebody in front of you with a motorcycle without helmets on, and it almost gives you that moment of panic of like, please don't fall. Please don't hurt yourself. Please, 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 because I don't want to be the one to have to be first on that scene. And I definitely don't want to be the one behind you where you accidentally injure somebody.
Yeah.
A good friend of mine, her daughter, well, I guess her daughter's my friend too. Um, she was kind of in a bad situation where there was a motorcyclist who wanted to take his own life. He turned off his lights and drove straight at her and unfortunately took his own life at her expense.
Oh, geez.
And so, these things are unfortunate, and they're things that you'll never forget, and they can be triggering um, to see people without a helmet, or that's just one example. But
Yeah.
anyways,
Well,
not
that
really.
didn't end on a great note, but
No, I sure didn't. I'm sorry. You start talking, and all of a sudden weird conversations come up. But
yeah. Yeah.
anyways,
For me it's now I can't go there right now.
okay, let's find a half of your topic to end on.
Okay. Um I'm having a hard time right now.
I know, I get it. You know what? I went to Nurse Blake last weekend.
Oh, okay. Tell me about that. We didn't talk about that yet.
We haven't. And I have to be honest, I was a little surprised because I've watched tons of his videos, and I actually used to play some of them for my students because they would be coming in all nervous. And one of my main job when I first started in the school was being a simulation coordinator. So we would do lots of simulation, and they would come in really nervous. And so I would play him this little video of Nurse Blake, and he is like doing a check off of himself having to put in a catheter, and he is in the video like practicing putting the IV in, and then he's like halfway there, and he's like, "Oh my god, I'm so nervous, I don't know what to do." And he's like, "Oh wait a minute, I'm supposed to be putting in a catheter? Oh shoot, I'm just gonna come back and do the retakes." And it was funny, and it was like nonchalant, and I had no idea how crude he kind of could be, and a lot of what he said. And mind you, I'm not easily offended, so none of it really offended me. But I work at a Catholic institution, and I was thinking about all my colleagues who are in their 60s and 70s who were there. And I'm like, oh my God, I can't imagine what they're thinking. Because some of what he said was, although very funny, and I enjoyed it. And Nurse Blake, if you ever see this, which I doubt, know that I was highly entertained by you. But at the same time, there was some things where I was like, oh my God, I can't believe he's saying that. Oh my God, I can't believe he's doing that on stage. And so it was interesting.
That's funny.
Yeah. I mean, I knew he was.
So he got invited to your school to
Oh,
give a
yeah.
show?
He did 2 shows at our school, but I don't think when they signed him up that they understood exactly the way that he presented content.
Oh.
Because definitely not normal in a Catholic institution. And yeah, he's funny. I love him. I think he's great. And I'm glad that he's made a great career out of his comedy, especially about nursing, and um, definitely things you can relate to in it. But uh, yeah, like he roasted every department at the end, like ER and ICU and all these things. And then his cousin, who he kept referring to as his gay cousin, who was doing the lighting and stuff, and then he'd pick on her. He also is gay, for those who may not know, and he was talking about that throughout the show. And then she came out at the end and did one more of this revolution of who are we going to pick on, and it came up as Nurse Blake, and then she roasted him at the end, and it was kind of funny. But yeah, it was an interesting show.
I
Very
bet.
entertaining. I'm not saying I wouldn't go see him again, but now I know what to expect. I know how he doesn't follow the rules, not the Catholic institution rules anyway. So I guess I was surprised that he came to our school and was able to
Give a
talk.
second show?
He did too. And he actually said that he's like, yeah, I'm pretty sure that the people who came to the first one came to the first one because they're part of palliative care, meaning that they were all older and didn't actually appreciate their humor. And he did say a couple times where he's like, yeah, I said some things, and then you could tell that they were not amused by what I said. I was like, yeah, I can imagine. But yeah, because when we came in, the other show was just leaving, and a lot of them were definitely of the older generation. A lot of,
And they didn't look amused.
well, I'm sure some of them were not amused. I know one of my colleagues who was very religious left after 10 minutes.
Oh,
But
that's funny.
my friend and I were laughing our asses off. So, I mean, by the end of the day, your cheeks hurt and your belly hurt because you were laughing so hard. But I could easily see how people would be offended.
Yeah.
So,
You get what you get when you, I mean, you should know ahead of time what you're getting into before you do something like that.
but too funny. Although it's nice, there's so much that's not funny about healthcare that we can enjoy a little bit of laughter at the expense of what we do in life.
Yeah.
It's definitely worth it to take those moments of laughter into our time.
Yeah.
A lot of times I think we kind of get a bad rap because family members might hear the nurses laughing or they think we're making fun of them.
Yeah.
But really, that's just our way to get through some of the hard times and the emotional times that we go through because we see such crap.
It's hard to cope. I mean, it can be really, really, really hard to cope sometimes.
I know there's been more than once where I've had like a really bad code with a bad outcome, and you're like, okay, I just got this patient down to the morgue or up to the ICU, and they're finally getting stabilized, and you're like, can I please just have 5 minutes, just 5 minutes so I can put something in my mouth or take a break. I don't smoke, but man, I'd love to go outside for 5 minutes or do something. They're like, nope, there's an ambulance coming in. This is the crap you're going to deal with in 5 minutes. Get in the room and get ready. And you're like, all right, I guess I'll take a breath later. Because it's one right after the other some days, and you just don't get that few moments to decompress that you really need. So good mental health and good ways to cope is so important. And I try to stress that with my students as well. I'm like, figure out your coping mechanisms, whether it's taking your dog for a walk, taking a bubble bath, listening to music on your way home, whatever your silly thing is that makes you feel like yourself and can kind of like get the roughness of your day over with, because you need that or you
can't take it home with you.
No. I do remember more than once when my daughter was little and I would be coming home from these sexual assault cases, or actually when I had that 13-year-old girl, my daughter was 12, where I'd just come home and go in bed with her and snuggle up next to her. And she's like, what's going on? I'm like, go back to sleep. Mommy just needs a hug. She'd be like, oh, is that kind of day again, huh? I'm like, just lay down. And she was so sweet. She would just let me snuggle up next to her and, hold on to her for a few minutes. And that was like my version of decompression for the moment. And now my decompression is either my husband, which is great, or, a kitty or my dog, and just giving him a little bit of loving and
or the hot tub and an old fashioned. There's that too.
Well, yes. Recently we did get a hot tub, and my husband does make a mean old fashioned. So sitting out there in the hot tub with an old fashioned is definitely a way to decompress for sure. And if you can do it with friends, that's even better.
Yeah.
So,
all right. Well,
do we have a product we want to talk about today?
Yeah. Why don't we talk about our probiotics and prebiotics? How about that?
Oh my God, they're so helpful to me. I have had issues with my GI system and having IBS since probably the day I was born. I cannot tell you how many doctor's appointments I have gone to because I've had belly pain and constipation. And as an ER nurse, I'm like, I'm never going to the ER again for belly pain, for constipation. And for me, those products have really helped a lot. So I'll let you talk about it a little bit more. But for me, it's definitely been very, very helpful to be on them.
So all I'm going to say is that a lot of us have I don't know if everybody knows, but you have a thing called your microbiome, which is just the bacteria makeup in your gut. And most of us don't have a healthy microbiome because we've got, it changes over the years as we take antibiotics, as we eat food, which is often processed. It often changes because of the amount of sugars that we intake. And to have a healthy microbiome helps us be healthier, because your gut is most of your immune system, which is something that we only learned in the last 10 years or so, that your immune system comes from your gut. So having a healthy microbiome is super important. So our prebiotics and probiotics help to support your healthy gut microbiome by giving us the things that we need to feed the gut with the right bacteria. So we've got that. The two-part system. You take the pre and the probiotic. The prebiotic is a drink that you mix in, so about 8 ounces of water, and the probiotic is a pill. And it really does help. It takes time to reset a very unhealthy gut, but it can help you. And it has helped me a lot. I've tried other probiotics and it has not gone well. All I ended up with is bloating and gas. And I've tried two different ones from other companies that are very expensive. And I've taken them for a long time thinking this is going to get better. This is going to get better. It has to get better. I'm paying so much money. It never got better. And eventually no one could take it anymore because the gas and bloating was so bad. Well, they didn't like the gas. I didn't like the bloating.
Exactly.
So I tried ours and I've tolerated it very well. I think that's because there's also a prebiotic component. And my gut is doing much better than it was before. So I know that, and I also take an immunity support that we talked about before, the daily wellness, I think. But it's really going very well, and I'm very happy about it.
Yep. And so if you don't know, I have added a link to Julie and my web pages onto our channel. So if any of these products do spark your interest, you can either ask us about it directly or go onto one of our pages and order it from there, because certainly we'd love for you to utilize our products because we think they're amazing. But if you have questions, feel free to let us know. If you have other topic ideas that you want to talk about, let us know. Otherwise, we will see you next time. Have a great day.